Good morning, good afternoon, or good evening, depending once again when you are taking this lesson. My name, or the series of these lessons, my name is Mr. Kanwar and I am Director of Science. Today's lesson is, again, the topic is B5. It is homeostasis and response. It is still paper 2. However, this lesson is for triple students only. So if you are combined students, you need to move on to the next lesson. I know there seems to be quite a lot of triple only content here. So this is for triple only. This is B5 lesson 7 and your title is water and nitrogen balance. Okay, so that is today's lesson. That's what this video will go through. So just as a reminder, triple students only. It's B5, it's lesson 7, it's water and nitrogen balance. So just to start us off, a quick recap of what we did previous. So 5 questions for you. You can just label them 1 to 5. You don't need to write the question out at all. So what organ produces insulin and glucagon? Question 1. Question 2. Does insulin raise or lower blood glucose concentration? Question 3. What is a risk factor for type 2 diabetes? Question 4. What is the master gland called? And question 5. What happens to the blood vessels during vasodilation? All the questions are taken from previous lessons. They might not be the last lesson, but they were taken from the last 2 or 3 lessons. So I shall give you a minute to get some answers down. "30 seconds. Okay, so let us go through some of the answers for this. What organ produces insulin and glucagon? The organ is the pancreas. Does insulin raise or lower blood glucose concentration? So remember, insulin is released from the pancreas, as question 1 states. It is only released when you have, for example, increased your blood glucose concentration. So what is the role of insulin? It is to lower it. Okay, so insulin lowers blood glucose concentration, and if we remember how, it does 2 things. It is able to move glucose into cells for respiration. That's number 1. And number 2, it is able to convert glucose into glycogen, and that is stored within the liver. So that's what insulin does. Question number 3, what is a risk factor for type 2 diabetes? Be careful with this. It's asking what is a risk factor for causing type 2 diabetes rather than a risk of type 2 diabetes. So it's very strangely worded because some of you may have put heart attack and so forth. That's the risks of type 2 diabetes. It is not a risk factor for type 2 diabetes. That is how is it caused. Lack of exercise, poor diet. That's generally what you'd put down. What is the master gland called? If you remember, it is called the pituitary gland. It is located in your brain. And what happens to the blood vessels during vasodilation? If you remember the lesson that we did on thermoregulation, vasodilation, the word dilate means to expand or dilate or get larger. Vaso, we talk about blood vessels, so basically they enlarge. Okay, that's generally what happens if you are feeling hot and you need to lose heat via radiation. So the blood vessels move towards the surface. So that's a quick recap. Just make sure that you've got all those correct. If you haven't, write down the question and the answer that I've just gone through. and we can continue with today's lesson. So what are we going to do? Our challenge is describe how the body maintains the water balance of the body. No, I don't need to really say it. Describe how the body maintains the water balance of the body. But how does it maintain water balance? And our Aspire, explain the role of ADH. And I've put brackets higher here, I'll come back to that in a second, in regulating the balance of water in the body. So ADH is a hormone. Now, the specification states that this part of it is higher tier for triple. Now, the majority of students studying triple will be higher tier anyway. This doesn't mean it's higher tier combined. It is still triple content. It's just specifically higher tier triple content. So if you were to take the foundation paper on the triple pathway, you wouldn't be expected to know the answer to that question. However, it is highly, highly unlikely that you will be as you listen on the foundation paper for triple. But do check with your teacher or head of department. So question number 1. How do you lose water, ions and urea from your body? Now you might not know what urea is. That's okay. Just assume well, no, I'll just tell you rather than assuming. It is the chemical that basically makes urine. Okay, name the processes on how you lose them and try to describe them. Okay, just describe what happens. I'm going to give you 2 minutes to have a think about how do you lose water, ions and urea from your body. There are 3 or 4 processes, and try and describe them. So you've got 2 minutes or just under 2 minutes now. Okay, just under a minute. Okay, so hopefully you got some thoughts down. What I'm going to do is I'm going to explain some of the answers to this question through some notes. So these are notes that we will need to get down. So the first thing is that water can leave the body via the lungs during exhalation. Okay, the word exhalation just means to breathe out. Okay, so the simple movement of breathing out, there is water being exhaled out. So if, say for example, if you went to a cold window and you breathe on it, you would see like water droplets essentially, and that is because water vapor is left. Water, ions and urea are lost from the skin in sweat. Okay, so when you sweat water, obviously because it's a liquid. You sweat ions, that kind of makes it, sometimes people say that it sometimes makes the skin sweat a bit salty because you can taste it. That's the reason. But also, this is quite gross to be honest, it releases urea, the same chemical that you find in urine. That's why it explains those yellow patches. And then there is no control over water, ion, and urea loss by the lungs or the skin. So we can't control that. That's just an automatic thing. So as you breathe in and out, so you lose water. As it gets hot, so you sweat. And you're not really in control of that. However, the body is in control of removing excess water, excess ions, and excess urea. That means water, ions, and urea you do not need or the body does not require. They are removed by the kidneys through a process of filtration. We'll talk about that in more detail in a bit. In the urine. So basically all the excess, all the waste water, all the waste ions, and all the urea, which is a toxic chemical, all the urea needs to be removed, and that is removed when you go to the toilet through urine. Okay, so that's how you can lose water, ions, and urea. If you don't have a chance to catch that up, just pause the video, otherwise we shall continue. If body cells, and this is important, this last bit, if body cells lose or gain too much water by osmosis, they do not function efficiently. This is why dehydration or overhydration, when you have too much, is a problem. Because what will happen is that either water will be gained or lost within the cell. The cell may lose or gain its turgidity, i.e. how structurally sound it is. If it loses how structurally sound it is, maybe some of the chemical reactions can't occur as they should. Maybe ions or oxygen or carbon dioxide, so forth, that come in and out of the cells can't be as efficient as it was before, and then you feel lethargic or tired, for example. We can even get the shakes if you are so hydrated or dehydrated. So those are the reasons why having too little or too much water is a problem, and that is why we need to control it. So I'm going to give you 30 seconds, and in that 30 seconds you've got a chance to get those 4 points down. So water leaves the body during exhalation, water, ions, urea lost through sweating, no control. However, we can control what's lost through the kidneys, and we do not need to lose or gain too much water because otherwise the cells will not function efficiently. Okay, now this is the higher tier only section. However, like I said before, the majority of students who do the triple pathway are higher tier, so you will still need to know this. So so when we talk about urea in particular, there are certain things that we need to know. Now this is a popular 3-marker. A lot of the time the question may ask, what happens to the urea? What happens to excess proteins? It might be worded like that. So the digestion of proteins from the diet results in excess amino acids. Remember that proteins get broken down into amino acids. Sometimes we have too many. That's fine. We need to get rid of them. Okay? So sometimes we have too many. We need to get rid of them. Now, how do we get rid of them? In the liver, these amino acids are deaminated, which is a process, okay? Deaminated to form ammonia. You don't necessarily need to know what deaminated means, apart from the fact that it changes or converts amino acids into ammonia. So this is ammonia in the liver. Now, ammonia, as we know, is toxic. And so it needs to be immediately converted to urea for safe excretion. So what happens is the ammonia is therefore converted into urea. That urea then goes into your bloodstream and is then filtered by your kidney, and it goes into your bladder. And we'll go through that process again. But these 3 points you definitely need to get down. So I'm going to give you a minute to do so and make sure. And the reason why I put them in 3 paragraphs is because they are the 3 marks that you would get. Okay, so digestion of protein results in excess amino acids. They are deaminated in the liver to form ammonia, which is converted into urea to be excreted because it is toxic. Okay, that's what you need to have down. Okay, hopefully you managed to get those points down. Don't worry if you haven't, just pause the video and then you can do. So just a quick check on to make sure that we've got the right answers and we're heading in the right direction. So I've got some questions for you that you can spend some time answering. Check through your notes if you require. I'm not expecting you to remember them straight away, but if you can check through your notes to make sure that you are able to answer these questions. So question number 1. How is water lost from the body? You can describe the processes involved. How are ions lost from the body? Again, you can describe those processes. How is urea lost from the body? That's question 3. By what process do cells in the body lose and gain water? Okay, so by what process do cells in body lose or gain water? And then the final question before we move on to the specific higher tier questions, what happens to their, i.e. the cell's functionality? You know, what happens to the cell's functionality? Those higher tier questions specifically, what do proteins get broken down into? Question 2, which organ deaminates the products above into ammonia? Question 3, why does ammonia need to be got rid of? And what is ammonia converted to? Okay, so those are your 9 questions. What I'm going to do is I'm going to give you 2 minutes. However, if that's not long enough, you can pause this video and then you can continue to answer those questions, but I'm going to give you 2 minutes. A minute and a half remaining. Just over 1 minute remaining. Remember, I don't want to rush you. If you are feeling that I haven't given you enough time, just pause and then we can continue. Okay, time is up. What we'll do is we'll go through some of the answers. So, how is water lost from the body? 3 different ways or 3 different processes. Exhalation, that's the breathing out. Sweating and urine, or urination. How are ions lost from the body? Now, ions such as calcium, potassium, sodium, and so forth can only be lost through sweat and urine. How is urea lost from the body? Sweat, and I do state that is quite gross when you actually think about it, and urine. Question 4, by what process do cells in the body lose or gain water? Osmosis. Remember, the movement of particles from an area of dilute to concentrated solution. That's the process of osmosis. Question 5, what happens to their cells, i.e. the functionality? Well, they become less efficient, don't they? If they lose water, they're not going to be as efficient. So our higher tier questions, what do proteins get broken down into? They get broken down into amino acids. Question 7, which organ deaminates the products above into ammonia? It is the liver. So remember, those excess proteins get taken to the liver, it gets converted into ammonia. Why does ammonia need to be got rid of? It is because it is toxic. That's the answer to question 8. And then the final one, what is ammonia converted into? It is converted into urea. Okay, so those are your answers to those questions. If you've got any wrong, not a problem. Just make sure that you've written the question down and the answer, or you've just written an answer with the actual question within it. All those answers should have been in your notes previously. So if you've not been able to find them, then perhaps you need to go back to your notes and make sure that those notes are correct. Right, okay, so we've spoken about ammonia, we've spoken about how we get rid of it, excess amino acids, how we get rid of excess ions, and how we get rid of excess water. And it's a process of converting it into urea, and then that urea is carried. Now, what I want to show you here is the urinary system. Now, what do you need to know? You need to be able to obviously label the kidneys. Okay, so the kidneys are the main organ that filters the blood and the water. You also need to be able to label the bladder, as you can see. So the kidneys are connected to the bladder through a tube called the ureter. Okay, so there's 2 tubes, one coming from each kidney, as you have 2 of them. And then from the bladder, you have the urethra, and that is where the urine will move from the bladder to the outside, preferably a toilet. So that's what happens. That is the urinary system. You need to be able to label them. I've kind of given you some more detail in terms of like what they actually do, and we'll come back to that. You do not need to be able to draw the right-hand diagram in terms of the nephron. Actually, you don't need to be able to draw either diagram. You just need to be able to label the left-hand diagram in terms of kidney, ureter, bladder, and urethra. The likelihood is it will be a tick box, or it will be they'll give you the labels and ask you to label them. Now, the kidney is made up of small nephrons. Okay, those nephrons are small tubes essentially. Okay, so the kidney is full of lots of small tubes. Each of those tubes have capillaries wrapped around it. Now, if you remember from our science previously, particularly when we talk about exchange systems, okay, so going back to that topic in particular, what happens is when you've got blood capillaries around a tube and you've got liquid within that tube, you can have osmosis or diffusion occurring. Okay, because you've got osmosis and diffusion occurring, you've got products leaving and coming in. So here, as it states, blood with waste products arrives through the renal artery into the kidney, into the nephrons. What they do is they filter the clean blood and it leaves via the renal vein. All the waste products or the excess products, okay, are taken to the bladder. So that's basically what happens. Now I'm going to give you some notes for that. So function of the kidneys is your subtitle. This is a classic 3 to 5 marker, or even possibly a 6 marker that comes up in the exam. So it's something that we do need to be absolutely sure about. Knowing the titles for each of the stage. So if you assume that there are 3 titles for the stages, so filtration being the first one, the second one being something called reabsorption, and the third stage, the creation of urine. They are 3 stages. What we've got is we've got each stage with the process next to them. Okay, so number 1, filtration. So what does the kidney do? It filters out urea, ions, water, and glucose. It takes them out. However, it cannot take proteins out. And the reason why it can't take proteins out is because they are too big to fit through the capillary wall. Okay, so it is selective. It's important because we still need our proteins. The proteins that are remaining are the ones that we need. Remember, excess proteins get converted into urea through deamination. We've spoken about that already. The other proteins are proteins that the body requires, and we don't want them to escape. If proteins escape, That's not good for the body. And that actually is an indicator of kidney disease. So one of the things that they check, doctors, nurses, and labs, what they will check if they were thinking that your kidneys weren't functioning properly is if there are proteins in the urine. If there are proteins in the urine, therefore there is a problem with either the pressure or the ability of the kidney to function correctly and not to allow the proteins to come out, because obviously they shouldn't be. So a reminder, filtration, what it does is filter all the urea, all the ions, all the water, and all the glucose out of the blood. The second stage is something called reabsorption, and as it states, that the blood reabsorbs all the glucose, water, and ions, but only the water and ions it needs. Obviously, it does need all the glucose, and some of the glucose will go back into storage. You shouldn't really have glucose in your urine either. So all the water it requires and all the ions it requires. All the excess is lost, and that is converted into urine. So urine is full of urea, which does not get reabsorbed. Okay, so urea does not get reabsorbed, and all the excess water and ions. Now, I've spoken a lot there. What I'm going to do is I'm going to pause. I'm going to give you some time to get that down as a flow diagram or as the stages 1, 2, 3. I'll give you 1 minute. Pause the video if that's not long enough. The image of the nephron anatomy on the right hand side is not something you need to be necessarily familiar with. It is something that you need to know for A level for certain. However, for GCSE, you do not need to know, apart from the fact that it is a specialized organ for absorption and filtration. So as long as you understand that, then that's absolutely fine. Okay, so now we're going to move on to a certain section. Now this is linked to our respire. So we know how the kidneys work. We know that it filters and we know that it reabsorbs. However, there's something that controls it. Okay, how does it know whether to filter it? What is excess? Because obviously different people will have different excesses depending on the circumstance that you find yourself in. Let me give you an example. If you are running, you are going to be sweating a lot. If you're sweating a lot, you're losing water. Okay, so therefore that could lead to a high concentration in your plasma. If you've got a high concentration in your plasma, it means you've got too little water. A, you need to drink more. Okay, that's something that you can do. However, what does the body do? Well, the body will make sure that it keeps the water it needs because it's losing so much. Now, if you think about it, on the days when it's hot and sunny and you've not drank enough, there is an indicator that will tell you you've not drank enough. Now, I'm not suggesting you go and look at your urine, but when you go to the toilet, when you urinate, you will find that your urine is very yellow in colour. That is because your body is keeping the water within itself. And the reason why it's keeping within itself is to make sure that the cells function efficiently. So remember, it goes back to the previous points that I've made. Now that is controlled by a hormone called ADH. Okay, so the hormone is called ADH. Now, if you've got low concentration in plasma, your ADH levels will either increase or decrease, and we'll come to which one is which in a second. But what I'd like you to do before we carry on, I want you to draw this table that you can see in front. So plasma, problem, too little or too much water. ADH, does it increase or decrease? Effect of the ADH and the effect on the urine, i.e. is it going to be concentrated or not? So I'll give you just a minute to get that table down. If you need more, no problem, just pause the video and we shall go through it. So a minute to get that table down. Okay, so let's go through it. So when the plasma has high concentration, okay, so when the plasma has high concentration, there is too little water. So what happens is the body releases ADH. So there's ADH in the bloodstream. What does that do? It causes water to be reabsorbed by the nephrons. So there's less excess. Because there is less excess, it means that the urine becomes more concentrated, i.e. it will turn yellow because that's the colour of urea. So let me just go through that again. If you've got a high concentration in plasma, that means you've got too little water. Now think about it logically. If you've got too little water, you need to get more water. Okay, so therefore you shouldn't be losing water. So ADH increases, and the effect of ADH increasing will cause more reabsorption, and therefore you'd get a more concentrated urine. So that's what happens when you've got too little water. Now the opposite is true when you've got too much water. Say for example, it's a fairly cold day, you've got all your thermal layers on, and you're drinking lots, but you're not actually losing that much. You're not losing that much water through sweat. And so forth, and you're not being energetic, so you're not losing that much water in terms of exhalation. So what's going to happen is you've got too much water, the ADH decreases, and because the ADH decreases, it means less water is reabsorbed by the nephrons. Because less water is reabsorbed, the urine becomes more dilute, and that is it in a nutshell. And as long as you remember one, so either at high concentration or low concentration, the other one is the opposite. It's the best way to remember things like this. But that is your Aspire. Explain the role of ADH in regulating the balance of water in the body. I'm going to give you 1 minute to jot that down in your table. Again, if you need more time, then just pause the video. Okay, so what we've done so far is we've described how the body maintains the water balance. We've also now explained the role of ADH in regulating the balance of water. Now there's a further step. Sometimes your kidneys don't work, or sometimes they don't work properly. And if they don't work properly, there are certain things we can do about it. Now what I've got is a video. The following video is in regards to a process called dialysis. Okay, so I'm not going to talk about it much more. I would like you to watch the video and then we'll discuss it after.
You need your kidneys to live. It's obviously very important. Unfortunately, some people lose their kidney function. It's either due to chronic illnesses. The most common form of chronic kidney disease in America is diabetic kidney disease. In addition to that, people lose their kidney function acutely, suddenly, due to a catastrophic illness or some intermittent reversible illness. When that happens, people need acute dialysis as a life-saving treatment to allow them to have a reversible of their acute medical problems and survive. The dialysis is typically done either in the intensive care unit or here in the inpatient dialysis clinic at Piedmont Hospital. Often dialysis is a bridge to transplantation, and people on dialysis are often on the kidney transplant waiting list, and hopefully at one point in the future will get a kidney transplant either from a family member or a loved one, or alternatively through the deceased donor kidney waiting list. Dialysis is done typically in two different ways. The most common way it's done is a treatment called hemodialysis. Hemo refers to blood, so in this treatment blood is removed from the body, treated through a dialysis kidney filter, and then returned back to the body. People on this treatment can have a normal daily lifestyle. They are able to participate in their normal daily family activities. A lot of people on this treatment can go to work on a regular basis and are able to have a good quality of life. The second form of dialysis is called peritoneal dialysis. So peritoneal dialysis that allows people to do the dialysis treatments in their own home. The treatment involves using your own body, using the peritoneal cavity to do the dialysis. Fluid in the peritoneal membrane can be exchanged to remove kidney poisons and extra fluid, and therefore allows the individual to replace their kidney function and restores them to good health and normal daily activities.
Okay, so that video was going through dialysis, which is a process once your kidneys are not functioning as they should do. Now, there are some advantages and disadvantages of going through the process of dialysis. So we can get these down. So advantages, what does it do? Well, it greatly reduces the levels of urea. Remember that it's about the kidney not being able to function properly. We must excrete, i.e. get rid of, urea at all costs because it is toxic. So it's really important that part of the dialysis process is that it's cleaned, okay? There is no overall change in the blood glucose concentration, okay? So basically we make sure that the blood glucose concentration remains the same. We also can manually correct the water and iron balance, so to make sure only the excess ones are removed. But there are some disadvantages. It's really expensive, okay? So it's really expensive to have dialysis. The patient needs to be connected to a machine several hours a week. Now, we're getting better. The technology has moved forward, so they don't have to spend as long. I mean, there used to be a time when they'd spend 3 or 4 hours on the machine on nearly every single day or every second day, and that's just to make sure the blood was cleaned. We've improved our technology and the way things work in the fact that you can have like mini dialysis packs that someone can carry around with them. However, you need a catheter and so forth to make sure that can happen. So that's important. Also, patients must follow a very rigid diet, so they can't eat what they want. Okay, they can't eat what they want. They have to make sure that they keep the blood glucose levels, the correct iron and water levels, as balanced as possible. And it only works for a limited amount of time for a patient. Eventually, we have to come to a different solution. So what I'll do is I'll leave that slide up for a minute. Grab any points down that you have missed. So advantages and disadvantages of dialysis. You don't necessarily need to remember all of them. As long as you're familiar with them, the likelihood is any exam question would ask you for a pro and con of dialysis and transplant, which is what we're going to talk about next. $30. So that is dialysis. Again, if you've not managed to get all those points down, just pause the video. That is dialysis. A second way of solving a problem in terms of kidneys is we can have a kidney transplant. So I've got another short video that talks about the advantages and disadvantages of transplant versus dialysis.
Most patients that come into our clinic come in thinking that they just want to get off dialysis. Dialysis, they have to go 3 times a week for 4 hours at a time, and it drains you, and a lot of them describe it as miserable. And so most patients just come into clinic saying, I want to get off dialysis, that's why I'm interested in transplant. And what they don't realize is that there's also a huge survival advantage with transplantation compared to staying on dialysis. So if you took a typical 30-year-old, let's say, that's on dialysis, their life expectancy is only about 15 years with dialysis. With a deceased donor kidney transplant, a kidney from somebody that's brain dead, their life expectancy goes up to 30 years. And with a living donor kidney transplant, it goes up to 40 years. So you take somebody from at age 30 is looking at, half of patients are dead by age 45. They get a living donor kidney transplant, half are still alive at age 70. And it is a huge quality of life advantage, but it's also a big survival advantage too. So you live longer with a better quality of life. The risk of kidney transplantation are pretty small. So most patients that go through a transplant are in the hospital for 3 to 4 days, and very few have a major complication with surgery. About 1.5% to 2% have some complication. So 98% don't have a major complication surgically. But the long-term risks of transplantation have to do with immunosuppression and the risk of rejection long-term. You have to be on medicines for the rest of your life that suppress your immune system so that you don't reject the kidney. Unfortunately, those medicines put you at risk for not being able to fight off infections, and also a higher risk for every kind of cancer that we've looked at. So every transplant recipient has a little bit higher risk of basically every kind of cancer that's been studied. But long-term, rejection is a big concern, and that's why it's so critical for our patients to be on top of their medications every day. The good news is most patients that do that stay on top of it and that get their medicines, take them every day and get their labs checked frequently, the vast majority of them do well, and their kidneys do well for a long time.
Okay, so that video went through some of the summary, went through some of the advantages and disadvantages of dialysis versus transplants. And what I've done is we've got a table here in front of you that basically summarizes those points. Remember, any question that they give you on there on the exam, they'll give you some information, and it's for you to then pull out. It's a comprehension exercise. It's for you to pull out the right answers. However, there are some points that are just true regardless of what situation they give you or what scenario they give you. Advantages of transplants is that it can lead to a normal way of life. They don't have to worry about what they eat and what they drink. Also, it's cheaper for the NHS, okay, because you don't have to keep coming back into hospital. The disadvantages of transplants is that you need to take drugs, immunosuppressant drugs first, to reduce the risk of infection. That increase the risk of infection. Okay, so how that works is you take drugs that suppress the immune system because you don't want the transplant to be rejected. Because you're suppressing them, it means you're more likely to get ill. The biggest disadvantage is there could be a shortage of organ donors. The kidney only generally lasts for about 8 or 9 years, so you need to make sure you do it again. And obviously, as with all operations, it carries risk. Dialysis, the advantage of it, it's available to all kidney patients. There's no shortage of it. And there's no need for immune suppressant drugs. So you're not going to necessarily get ill from it. However, the disadvantages are the patient must always limit their salt and protein intake. It's very expensive for the NHS, and it impacts your normal lifestyle because you always have to go into hospital to get the dialysis. Okay, so they're the advantages and disadvantages. If at any point I would pause the video now if you need to grab those points down. However, again, think common sense, think about what a transplant is, think about what dialysis is. if you come, once you start thinking about it, the answers that I've given you as the advantages and disadvantages should just arrive to you. Of course, if you need transplant, you need kidneys. It's only going to last a small amount of time, and it's an operation, so that's going to carry risks, and it could get rejected. Okay, so those are the things that you need to be aware of. Now, to complete this lesson, I've got some exam questions. This exam question is taken from a triple paper, clearly, and I've split it up. So there's the information that you get first. Blood is filtered in the kidneys. Some substances are then reabsorbed. The amount of each substance reabsorbed varies. We know that. Each day a person filters 100 dm cubed of water out of the blood, produces 2 dm cubed of urine. The diagram shows this process of filtration in the kidney. So, and then it gives you a key of all the sizes that you've got. Explain, so part A for 2 marks, explain why a protein is not found in the urine of a healthy person. You have 30 seconds. If you jot that answer down, if you need more time, just pause the video. So remember that the answer for that question was basically from the diagram. Part B. So part B, the question says, explain why glucose is not found in the urine of a healthy person. So why is glucose not found in the urine of a healthy person? My only clue to you here, it is not the same answer. So I'll give you 30 seconds again. Okay, again, if you need more time, just pause the video. And then the final question, which is worth 3 marks, what I want you to do is explain why urea and sodium ions are found in urine. So why is urea and sodium found in urine? Remember, go back to the whole process of what the kidney does. And why their concentration, so why the concentration of urea and sodium is higher on a hot day than a cold day. So why is the concentration of urea and sodium higher on a hot day than a cold day? It's actually got nothing necessarily to do with urea and sodium. That's my only clue to that. And I'm going to give you 1 minute, although it's worth 3 marks, so you'll need a bit more time. I'll give you 1 minute on this video. Just pause it if you need more. Thirty seconds. Okay, let's go through some of the answers. So, question 1 was talking about proteins. The first mark, proteins are too large and they cannot pass through the membrane. That's it. Okay, so they're too large and they can't fit through. And you could have got that answer just from looking at the diagram. Now, if you remember, what we did earlier when we spoke about filtration and reabsorption, the mark that you get is glucose is reabsorbed. However, you get the second mark for saying all glucose is reabsorbed. Yep. So that's all you need to state. Don't write absorbed unless you say into the blood. You need to really write, if you write reabsorbed, you get all the marks. So remember, ions, water, and glucose are filtered. However, all the glucose is reabsorbed, but only the non-excess water and ions are reabsorbed. So that's your answer. All glucose is reabsorbed. For part B, that's your 2 marks. And then part C, one of the things that is important is that not all of them are reabsorbed. So that we're talking about the molecules and the ions. Some of them obviously are going to be reabsorbed back, but the rest of them are not going to be reabsorbed. Remember, only excess. So the first mark is not all of them are reabsorbed. The second mark is linked to the aspect of it being a hot day. If it's a hot day, more water is reabsorbed. So if you take in more water and you sweat more water, it means the urine will be concentrated. So hot day, more water reabsorbed for the second mark, and for the third mark, more water is lost in sweat. And it states more because obviously sweating occurs naturally. Water reabsorption occurs naturally. It's just that when it's hot, there is more. I know they're being really picky, but you need to state the word more for that second and third mark. Now, hopefully, you managed to get minimum. It was worth 2, 3, 4, 5, 6, 7. You managed to at least get 4 out of 7. If you got 4 out of 7, you'd be heading for at least 5+. So that's what you need to be aiming for, remember. This is probably a question early on in the paper. I'd imagine it would be question 2 to 4. And you're looking at grade 5 to 6 because there is some higher tier content there. Right. That is water balance and nitrogen balance completed. Nitrogen balance being urea. That's basically all it was with ammonia. So that's water balance and nitrogen balance with dialysis and transplant. Join me. That is the end of lesson 7. Join me for lesson 8. I bid you a good day and I will see or hear from you soon. Thank you very much.